So this one was for you, Dame Donna, and it was, what does it say about existing approaches when the pandemic has shone a light on the inequalities that have been prevalent for such a long time?
That's an interesting question, because we've always known that racism or structural inequalities have existed, and we've always done things to try and alleviate. As a health service, we've done many things to try and alleviate. I remember, 25 years ago, trying to put services in to stop babies dying. So it isn't that we've completely ignored them, but I think what the pandemic has done is shone a light in the way that has made us question if all our frontline doctors, nurses, care workers are suffering to this extent. We need to do something greater. We need to do something on a collective basis. Also, just even the pandemic has shone a light on the fact that how do we enter those communities without people looking like those communities and understanding those communities, getting inside and helping them and us to really create services that make a difference for them. So it isn't that we've sat there for many, many years. I myself, as a young nurse, did a huge amount on sickle cell, individual items. But this is about a collective. This is about how you get to the root and branch of some of these issues that we face. And I love this review because it just doesn't deal with the issues on the ground, but it deals with the structural issues that can make it better for those on the ground. It makes sure that the voluntary sector, who those on the ground speak to, are a component part of it. So it's not to say that we haven't spent our entire lives, myself as a commissioner, but all of these good people in West Yorkshire and Harrogate, trying to make things better for individuals. But this is a collective approach, and it's massive. And we're not going to do it in one day. But what we've shown is a commitment to go further and deeper and truly understand it, but make sure that we've got the structures in place to do something about it.
Can I just add something, Karen?
Yes, of course, please, Dave.
So I think it's a brilliant question, and I think Donna's picked up the fact that this is a system response, and we've, for the last 4.5 years, been really clear that there are equal partners in this system, which are the communities we serve, the third sector, the NHS and local government, and other providers together. And only when we see ourselves as equal partners can we achieve the right outcomes. And only when we're working in and with our communities can we achieve the outcomes that we want. And it's just a plea to all my NHS colleagues, really. So when we get into the next inevitable conversations about what our ICS is and what should we do with CCGs and all that stuff, we should always ask ourselves the question, whatever we do, how is it going to make sure we continue to have an equal partnership? And how is it going to make sure that we continue to address these sorts of issues together?
I'll just whiz through the chat box if that's okay, Dame Dara, just in case there's any more questions coming in. Angwin's asked a question around accessible formats. We've got lots of accessible formats, including audio, British Sign Language, community languages. We've got a submarine and easy read, and we've also got films by people with learning disabilities and lots of films from our VCS colleagues. If there's anything missing, do shout out, because we're absolutely committed to being 100% accessible on all that we do, not just this, but on all we do. So thank you for raising that point. Perhaps this is one around the funding element. We look to invest in our communities following this review and ensure that we can get the funding. Can we do that? And I think that pulls on the point of Alison's.
So I think it's right that we ask the question about resources. And I think what we can point to as a partnership is that we have backed real work with resources. So during the pandemic, we knew from the work we'd done with the third sector that resilience in the third sector was challenged, is the polite way of putting it. And we put over £500,000 directly into third sector organisations with a focus on inequality. And we increased that amount as far as we could when we saw that there were a huge number of people wanting to invest. What we also can do as a partnership is connect to other bits of government and the system. And we know that the National Lottery is being given a significant sum to invest in the third sector to help with real issues. But the way that happens is quite clunky. So we went straight to the regional lottery and said, we've got a range of things here we could do if you've got the money, and some of those are now being funded. So I think direct investment and connection to other bits of the system is essential. But I think it comes back to the role of the partnership board in overseeing our 5-year plan and our economic recovery plan. And I know that Kirsten was on the call earlier, but in the economic recovery plan for West Yorkshire and Harrogate, we're talking about health and jobs and how they're part of our economic recovery. We're talking about, you know, the supply chain into health, which brings jobs. We're talking about research, which brings knowledge and jobs and skills. And we're talking about medtech as a big driver of the economy. And this review talks about making sure that those jobs, those opportunities are accessible to everybody, and that people don't think, well, that sort of thing isn't for me because of the community I live in or because of my background. So there's a direct relationship there. And then in the 5-year plan around how we're implementing our resources in health and care, the fact that we now have to report on, measure and deliver against our constitutional standards like waiting times with a view to inequality is helpful. But the recommendations in this report that says commissioning and planning needs to have an eye on it too can only help us direct the resources in the right place. Sorry, that's a very long answer, but I think it shows that this is a multifactorial response that's required. We have the levers, we have the leadership, we need to now put it in place.